Kingdom, pregnancy and infant loss awareness is one of the life events that the nations are shining a light on. This topic is especially important to the African American community because miscarriage rates among our women are higher than any other race. Yet, the experiences are rarely discussed. So today, we hope we will serve to promote a greater awareness and support for the estimated 1 in 4 individuals and families whose lives are irrevocably altered by the death of their children during pregnancy or at birth. I want to let you know we have a special guest today, Dr. Lucinda Canty. We'll call her Dr. Lucinda. And I invited her here because we both share a passion for and have devoted our efforts to the care of women after pregnancy loss. She will join us later in the program. So today I ask you to join us and embrace the goals for this session. If you have not experienced a pregnancy loss, it is highly likely that you know someone who has. And so we just ask you to stay with us as we take an intimate look at the experiences of coping and healing among diverse women after pregnancy loss. We'll share strategies women used, and we'll end with a meditation to soothe you, and which you may share with women, their partner, and other loved ones. So as we begin, we always begin with a centering exercise to help us focus and collect our energy for this time together. And remember, it's a time for you, a gift for yourself. So let's take a moment and settle into this space so we can be fully present. We're going to practice heart math, heart-focused breathing to open our hearts, because today especially may be emotional for many of you that have joined us. We're going to practice heart-focused breathing, and those of you who have been with me along this journey are very familiar with it. And those of you who are not, it's really simple. So join us. So I'm going to ask you to lower your gaze or close your eyes, or just have soft eyes focusing on something stationary. And we're going to focus your attention in the area of your heart, which is in the left side of your chest. So it might help you to put your hand over your chest. Can you see me? Can you see my hand? Yeah. Okay. All right. So I'd like you to imagine that your breath is flowing in and out of your heart or chest area, breathing a little slower and deeper than usual. Okay. So, and we want to do it slowly. So you might inhale on a count of 4 through your nose, 1, 2, and 3, and 4. And exhale through your nose, but if it's more comfortable, you can exhale through your mouth at the count of 5. 1, and 2, and 3, and 4, and 5. So let's do it again. Slowly through your nose. And you might want to push your belly out so you can get more air. And just imagine your heart. Every time you inhale, your heart's expanding. And then when you exhale slowly, your heart is contracting. Yes. Okay, let's do it one more time. And you're going to breathe in, and your heart, that beautiful heart of yours, is expanding. Big, 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 big. And then breathe out and watch it contract. And now, please follow me and take a deep breath in to notice you are here. Breathe out. Take another deep breath in to notice how your body feels. and out. And take this last deep breath to enter this session. And for those of you who have just joined us, I am Dr. Paulina Van, author of Regala Healing, an evocative approach for self-care, self-understanding, and inner healing, and the host of this show, The Poetry of Healing. And today's show is a sensitive topic. It's about pregnancy loss. You are just in time to meet our guest, and I'd like to welcome Dr. Lucinda Canty. Here you go. I got you on the screen, okay? For those of you who've been viewing, I'm being the director today as well, so be patient with me as I try to navigate all these roles. Well, welcome, Dr. Lucinda. It is so great to have you. We are of like minds and spirit, and you're just a gentle person, and I just welcome you. So I'd like to ask you and invite you to tell our viewers a bit about your background related to the care of pregnant and postpartum women, and then we'll get into our chat about pregnancy loss.
Okay, my name is Lucinda Canty, and I have been a nurse midwife since 1994. Can't believe how long it has been. And just throughout my journey as a midwife is working with women just throughout their reproductive life cycle. And people know me for my maternal health work, but I also just work really focusing on women's health and their needs. And pregnancy loss is one of those things that continuously come up, and supporting women through that process.
Mm-hmm. So, Dr. Lucinda, tell us what your role is right now. What specialty are you in? Mm-hmm.
Okay. So right now I am providing reproductive health at Planned Parenthood of Southern New England. So again, I care for women of all ages. I focus on helping them prepare for pregnancy and even helping them in the aftermath. But I also provide services and getting them the support they need during pregnancy and during childbirth as well.
And you know, I'm not going to let you get away with not telling us about your degrees.
Okay, yeah, so I received my nursing degree from Columbia University, my midwifery degree from Yale University, and graduated recently, 2020, from UConn School of Nursing with my PhD in nursing.
Okay, now, so everybody, we're going to breathe all that in, all those Ivy League schools, and yes, thank you, Dr. Lucinda.
Thank you.
You are just like I said, a gentle spirit. So before we get into the discussion about pregnancy loss, I just want to make sure that all of us, including our viewers, are using the same language. So I want to describe what we mean by pregnancy loss. And so pregnancy loss, miscarriage, ectopic pregnancy or tubal pregnancy, a stillbirth, or the termination of the pregnancy for any medical reason. Okay. All right. So let's begin. And I just want the viewers to know our connection in this work. I have been, I'm a little older than Dr. Lucinda, and I started this work in my PhD program back in 1995. And that's when Dr. Lucinda was becoming a nurse. She was a new nurse or a new midwife. And I've always had an affinity towards pregnant and parenting women and their conditions. And I became aware that African-American women have a disparately high rate of pregnancy loss as compared to other women, and up to 4 times of white women. So I'm a fixer. So I wanted to fix that problem. And I quickly realized that there's social, cultural, political, economic, cultural, religious reasons that lead to this high disparity. So I went to earn my doctorate and have been doing research among women who've had pregnancy loss since that time. And I've spoken to hundreds of women and I've traveled the world teaching caregivers and women about how to cope after pregnancy loss. So that's our connection. So, Dr. Lucinda, we know that 10 to 20% of all pregnancies end in miscarriage, and of course, it's higher among African Americans, and may be treated as a medical event or an invisible event, totally ignored. So, from your perspective, what would you like our viewers to know about the African American experience after miscarriage?
Yes, and thank you for that question because, and I'll just also say this is something that we don't really talk about in our community, and because there's a stigma associated with it. But I think that if we do talk about it, we'll recognize that we're not alone. So when we do enter regarding for pregnancy, it's always considered a joyous event. You start to think about what's going to happen when the baby comes. How am I going to do during my pregnancy and childbirth? But we don't really talk about loss. We don't really talk about it until I shouldn't say it doesn't come up until someone experiences it. And it can happen at any time. And I just want to say with pregnancy loss, each pregnancy means something to the woman or the birthing person, regardless of how, they became pregnant, how that pregnancy ends, it means something. But we know that when we enter the medical establishment, it's always focused on the medical pieces. Let's do an ultrasound, let's do blood work. And then when we find that loss has occurred, it's almost like we don't know what to say. And the women they don't know what to say because they're trying to adjust to what just happened. But as medical providers, as friends, family, a lot of times we don't know what to say. And sometimes what we say is not always helpful. Mm-hmm. So it's important for us to be very careful about that. Mm-hmm. But women are also kind of thinking, did I do something wrong? That's the first thing that comes to mind. Mm-hmm. We know that this happens outside of the body, outside of our control, but we still blame ourselves, especially as Black women, as women of color, because we're supposed to be strong. We're supposed to be successful. We work hard and we're always supposed to have something to show for it. So when things don't go as expected, a lot of times we don't know who to go to or what to say, who to get that support from.
Mm-hmm. Wow, you've covered question number 2 too, Dr. Lucinda. I just appreciate that, and so I want to delve. You brought up several challenges that women experience after pregnancy loss. So the guilt and the self-blaming and the I don't want to say negative, but unsupportive responses from others. Not knowing the cause. So that even causes anxiety. Don't know. So you can't do anything about it, most of the times. And that's important for our viewers to know that most of the time it's unknown why a miscarriage occurs. There are many theories about why it occurs, but it's unknown. And so as a healthcare provider for several decades, what have you found helpful when providing guidance to women after loss, knowing this pool of challenges?
Yes, and you have to listen to the person. You have to listen to the person who is going through it, and you have to give them time and space. When I was in school, we really didn't talk about what to do. We knew what to do medically if someone had a loss, but we didn't really know the right words to say. And it does take time to learn. I didn't come out of school knowing what to say, but I had to listen to how women felt. And if they had a previous loss, what happened to them? Because a lot of times if it's not addressed, they bring that to the next pregnancy. And again, like you were saying, that anxiety, they can carry that. And we don't want women to carry anxiety and stress through their pregnancy. Mm-hmm. But what I found too is that listening was the most important thing, seeing what their needs are, not saying, oh, don't worry, you're young, you can get pregnant again. Or someone told me the provider was like, oh, you're early, so it didn't really do anything to your body. You're going to be fine. Mm-hmm. Like those are things that can cause more harm if they have other questions and things that aren't being answered. So what I learned was to listen. Mm-hmm. And I would like to share an experience that I had with a woman. It's one of the most kind of devastating situations that I've had as a midwife, where I had a woman who was 39 weeks. And I do want to say this, describing this experience could be traumatic and could bring up feelings, evoke feelings, but I want to mention it because, again, we have to talk about it. So she came and she was 39 weeks, couldn't find the fetal heart rate, had a normal pregnancy, all her labs, everything normal. She was active, no medical conditions, and just came in and couldn't find it, got ultrasound. We saw the heart, but it wasn't beating. And I was devastated. So I could only imagine what she was going through. And I wanted to be a support to her. And what I found was I just listened to what she had to say. Of course, there was the medical pieces, and it turned out it was a knot in the cord, something that's very rare. So there was nothing anyone could do, but I knew that that wasn't good enough to help her what she was going through. So I just stayed present. I answered questions as they came up. And then she became pregnant a second time. It was like a year later. And I heard that she had a pregnancy test. She came in, it was positive. And I just worried that she wasn't going to want to see me because I would re-traumatize her. And I found out that they wanted her to follow up in the high-risk clinic. And she said, if I don't see Lucinda, I'm not seeing anyone. And came to me for her first visit. And I asked her how she was feeling. And she said, I just want to thank you because I didn't see her since the loss. And she said, you were the only one that listened to me. You didn't make me feel guilty. You didn't tell me things. You didn't tell me stories. You just sat and you listened. And I realized the power of being silent and again, but being present. And that was something that I learned. And this was early in my career. So I have that. I still practice that to this day because you never know what people are going through. And she found that something that helped her make it through. So we have to listen. Yeah, we have to listen to how they're feeling and where they want to go.
Dr. Lucinda, you bring up something, listening. Listening is free. It seems so simple, but to be an active listener means putting our biases aside, putting our opinions aside, and just sitting still and listening to the words, and the emotions, allowing these women. And I don't want to leave the partners out, but today we're talking about the women because partners have a response as well.
Yes.
And you're saying listen, and that takes effort, it takes practice, and it takes intention. You have to go to the situation with the intention of being an active listener. So thank you for sharing that experience with that patient. And I just like everyone, just take a nice deep breath in and open your heart and out. One more time, in and out. If you just joined us, Dr. Lucinda just shared an experience with a patient who had a late pregnancy loss, very, very near delivery time. And so we're just kind of breathing to get ourselves a little calm. Okay. All right. And so my last question for you is, would you share with us from your experience what women have told you has helped them cope, heal, just be able to manage day to day and accept the reality of the loss?
Yes. The most common thing that I have heard was that they wanted someone to not always have the answers, to just listen to their concerns and not feel like they have to go out of their way just to tell them something. Because sometimes that something could be something that they're not ready for. So that's one of the things is just, again, is that silence, is the listening, but it's also, you don't have to have all the answers. When we're sharing, especially when we go through something so difficult, we just want someone to be able to see us and know that it was important to us. And again, even for some women, pregnancy could be a crisis, but still, however that pregnancy ends, they have to recognize that that's something that happened to them and is not something I want to erase and disappear. So that if they do have a loss at any time during their pregnancy, it's important that people acknowledge that that happened to them and not, avoid saying miscarriage, not avoid saying baby. I had a woman who said people didn't even want to look at me. Or if they were sharing that somebody was pregnant, their face dropped because they realized my loss. But I was happy for that person that was pregnant. But I still don't want you to feel that you have to go out of your way and do things that aren't really comforting to me.
Yes.
But the other thing was not saying sorry. Don't say, oh, I'm sorry you went through that. Please don't say, oh, don't worry, you could get pregnant again. Or don't worry, and if they have a loss, they don't want someone to say, well, when is the next time you're going to have a baby? Give them a moment, let them heal, and realize that there is a guilt that women feel, but they have to be the ones to process it and go through. And then they'll come to terms that it wasn't my fault. This is something that happened that I had no control over. But us just telling them doesn't make that erase. And even if they do feel like I should have done this or that, they don't want someone to say, oh, don't worry about it. It's not you. So they just, again, want to be seen and heard, and they want to be able to talk about it. So if they start to talk, just to let them talk. Don't shut them down. Don't try to change the subject. Just let them talk and let them get out how they're feeling.
Yes, absolutely. And when we do otherwise, the women shut down. So we have to know that talking about a traumatic event, in this case, losing a baby or losing a pregnancy, talking about it is therapeutic. I remember when I first started inviting women to tell me their stories, at the point that they realized they had lost the baby and telling me the story, they always cried. And so I started, tearing up. And I would say, you can stop. You don't have to continue. And every single woman would say, I want to continue. This is the first time that I'm able to tell my story and not get it interrupted or not be told things like you can have another baby that is not helpful. So, Dr. Lucinda, we've just touched the tip of the iceberg on this subject. Yet, I think it may open awareness and open the doors. And we've given our viewers something very simple, and that is listen without judgment, right? So before Dr. Lucinda, we have about a little over 5 minutes left in the show, and I usually do a meditation and read a poem, and so I'd like to do that. And you're welcome to stay. I know you wanted to stay, but before I do this, I wanted you to tell our viewers a little bit about Lucinda's house. So you didn't mention that, but I know about Lucinda's house. So please.
Yeah, so Lucinda's house is my way of addressing racial disparities in maternal health outcomes. And it looks at pregnancy and childbirth, but also just women's health care and offering support. And although I talk about pregnancy and childbirth, we also talk about pregnancy loss. We also talk about infertility. We talk about issues that aren't commonly discussed. And I just want to say to women is that if a lot of women suffer in silence. I just want to say that there are people who don't even know they experience loss, again, because they don't feel safe to talk about it. But I just want those women to know that they're not alone. And the more we talk about it, the more we can see what your needs are in other women so that we can offer them support. Mm-hmm. So through Lucinda's house, we are going to have just open discussions. Just like how we're talking right now, it's not about giving a lecture or doing a class. It's really about us just talking about what's important to us and what we need to heal so that we can care for ourselves.
Thank you. And I'm going to, after the show, I'm going to put in the chat the information that they can, contact you and learn more about Lucinda's house. So we're going to move into our meditation. And this one I specifically chose because I knew that we were going to be falling into our hearts and discussing life and death, and it can bring up some emotions. And so I invite you, we're going to do another heart math exercise to close, but it's called Inner Ease. And it gives us an opportunity to pause, bring balance between mind and emotion so that we can act consciously rather than a stress reaction. And it helps much with personal stress and promote faster recovery. We call it resilience from stressful occurrences, which pregnancy loss is, and it can last, that response can last a lifetime. So right now, I'd like you to acknowledge your feelings, including if you're feeling stress, or you feel like you're out of sync, or you're having other stressors, and you may be feeling anxiety, you may be feeling frustration, or just overload, right? So take a short time out and let's do our heart-focused breathing again, like we did at the beginning of the show. So you're going to breathe in through your nose and imagine your heart expanding. And this is slowly. And then breathe out through your nose or your mouth slowly. Okay. Again, breathe on your own, breathing in and imagining your heart getting bigger. And then breathe out. And this heart breathing is proven to help restore balance and calm in your mental and emotional states while activating that affirming power of your heart. During heart-focused breathing, you just imagine that each breath is drawing in a feeling of inner ease and infusing your mental and emotional nature with balance, self-care from the heart. So remember how powerful and energetic the heart is. I spoke to you about this back in February 2022 when I had the program on heart math. So you might want to view that again. But your heart is powerful, and you breathe into it, and it has this immediate balancing and calming effect. So when practicing this heart-focused breathing and ease, putting ease in your heart, you will increase your awareness when that stressful emotion has calmed and you have a state of ease. And one of the things I like to, this is kind of navigating away from the heart math procedure, but when I breathe in the sense of ease, and when I breathe out, I say ease. And so I'm activating the power of the word ease. So I breathe in into my heart, ease, and then I activate the power of ease by saying the word ease. Okay, another way to anchor yourself in this ease is to say, I create what I want to for this situation. I send blessings to anyone who have hurt or disappointed me. That's part of my prayer every night. I send blessings to anyone who has hurt or disappointed me. Okay, so we're going to end this practice now and take a deep breath and notice how your body feels, and take a deep breath and return to this session as we close. And I typically read a poem for you before we leave, and I didn't choose one. Well, I had several, but I'm going to read this one. And because I want to remind us, it's in this moment. That's all we have control of, in this moment. And so this poem from my book, Regala Healing, is titled In This Moment. And it's on page 41 for those of you who have the book. In this moment, I reflect on my life. In this moment, everything is all right. In this moment, something's rising within. In this moment, it's everywhere I've been. In this moment, I feel an embrace. In this moment, it's all about God's grace. So please join me every first and third Sunday right here at 9 a.m. Pacific time. I ask you to like, share this program if it's been helpful for you or you believe it'll be helpful for someone else. Leave comments. I do read them and respond to your questions. Today, though, I'm leaving right after we end this broadcast because it's the anniversary celebration at my church, and I want to be there to celebrate with the other parishioners and my pastor. But as soon as I come back, I promise I will answer your questions or respond to your comments. And I'd like you to visit my site, regalahealing.com, to learn more about my healing and self-care work and resources. I want to thank you for joining Dr. Lucinda and I today. And as always, I wish you love and light until I see you the next time.